Welcome to tonight's webinar on advocacy in medicine. I'm Katrina Green. I am an emergency physician in Nashville, Tennessee. I am the chair of the Advocacy Committee of AMWA, and I am a brand new board member as of this past spring. So I want to talk to y'all about advocacy tonight, kind of my journey, how I got to where I am, how you can advocate, and I have a little slideshow presentation as well that I can go through. If I can figure out how to share my screen. I am so not technologically savvy. Let's see, am I able to share my screen? Here we go, share screen. All right, hopefully you all can see this. Yay, it looks like it's working on my end. Hopefully y'all can see it too. So yeah, we're going to talk about how to use your voice for public health. Just post a couple of screenshots here, pictures of a group of doctors that went to advocate down at our state capitol, and then myself speaking to a news program there. So what is advocacy? Just think in your head, like, what does it mean to be an advocate? What are we talking about here? What does it mean to you? Do you feel like you are already advocating, or are you just someone who wants to, learn how to do this, know a little bit more? What does it mean to you? I found a great quote from a lovely physician, Annie Andrews. If y'all don't know her, she is a very lovely woman. She's a pediatrician in South Carolina, and she had this quote in a recent article she wrote: "Research is finding the answer to a problem. Policy is turning the answer into a systemic solution. Advocacy is drawing attention to the problem and solution. And then lobbying is convincing people with the power to care. And then one step further, politics is changing who has the power." So we're going to focus more on the advocacy part of what she's talking about, but we will go into lobbying and politics a little bit too. And I had the honor and pleasure of meeting Annie at a fundraiser recently here in Nashville. And so that's a picture of the two of us there. Why do we advocate? What is it that we're doing? What is our goal here? Why do we do this work? Well, one main reason is to educate our legislators. Most folks who are elected to office are not physicians or medical folks, so they don't necessarily know the ins and outs of how their bill or law could affect us as medical providers or our patients and community members. You can help form public policy, so how kind of shape like what the legislators are attempting to do while they're in office. You can advocate for public health, and this was something that we've seen, especially since 2020 and the COVID pandemic, that physicians and medical providers are at the forefront of advocacy work when it comes to our public health system. And for me, preventing burnout. You can only do so much in your day-to-day job, when you're rounding on patients in the hospital, in the clinic, seeing people in the emergency department for myself. And burnout has become a huge issue in the medical field. There's so many tasks that we're needing to do in our day-to-day work, so many things that keep getting piled up upon us. And we can get very burned out easily and frustrated when we're just, going through the slog of seeing patients and doing our medical care. Advocating outside of the hospital can really help you prevent burnout, or at least it has for me. Another big reason is to fight misinformation and disinformation. There's so much of that being proliferated on social media these days, and even in the news media, you see it too. And so you can advocate and help us fight all of that bad information that's out there. Where can you advocate? You can advocate pretty much anywhere. For those of you who are still going through your medical training as students and residents, you can advocate in your hospital or clinic. I've seen medical students and residents advocate for healthier food in the cafeteria, having longer hours that the cafeteria is open so those that are on call have access to something to eat. Your local health department. During COVID, a lot of us lobbied our health departments and advocated there for COVID safety measures like lockdowns, mask mandates, better vaccine outreach programs. You can advocate in your medical school. when you're advocating for yourself as a student, but also your fellow medical students. Med schools are a great place to advocate for things like mental health care, the Time's Up healthcare and sexual harassment, things like that. Great place to advocate. In your organization. So this is the American Medical Women's Association. We have all sorts of things you can do to advocate within our organization. There's other orgs out there that you can advocate from within and without. It's been a long time coming getting the American Medical Association to advocate for a national single payer healthcare system. If you don't know your history, the AMA actually fought against that back when Truman was our president, and had a big role to play in why we don't have universal health care right now. But the times they are changing, the pendulum swings, and sometimes you can get the organization to advocate in a different way. And then there's advocating in your state legislature, which is a lot of what I'm going to focus on today. A lot of the bills that are getting passed and things that affect you directly are going to happen in your state legislature, not necessarily the federal government, because they're kind of at a standstill these days with both sides not wanting to work across the aisle to get things done. So you see a lot more movement for bills and discussion of things in the state houses. And so that's where you can advocate. Also the schools. So if you are someone who has children that are in public schools or are just passionate about keeping kids safe and healthy, we've seen that school boards are a place that folks can advocate for the health and well-being of children. When it came to COVID, it was, making sure they were wearing masks as well. Making sure that they were doing other safety measures in schools, better like air circulation, keeping kids at home when they were sick. And then with regard to gun violence prevention, doing everything we can to keep kids safe in schools from gun violence. And then just your general community. You can advocate for things in your day-to-day lives, in your neighborhoods with like neighborhood associations, in your city with like city council. Making sure that your roads are safe, that pedestrians aren't being hit by cars because there's not a safe crosswalk, making sure there's green spaces where people can exercise and relax, have leisure activities. So all kinds of different arenas you can advocate. So your first steps when you're looking at becoming an advocate as a medical person, I would just recommend start small. Find that one issue that you care about and start there and start talking about those issues. Talk with your fellow students, fellow residents, your attendings, other colleagues at work. It can be a little intimidating at first to talk about certain issues, especially if they're like the hot button topics like reproductive rights or gender affirming care. But just being willing to step outside of your comfort zone and have that conversation with somebody, you'll find that there are allies out there. There are other folks that are interested in getting involved and folks that are already involved that you can use as a tool to help you on your journey. Join your medical organizations. For most of you who are on this call, you've already taken that first step and you are a member of AMWA. If you're not, I would highly encourage you to join because I love this organization. But there's other great organizations that are doing amazing advocacy work like the American Academy of Pediatrics, the AMA. There's too many to list, but join a medical organization and start getting involved there. Attend the meetings. Don't just be a member in name only. Attend the meetings, attend the Zoom lectures like this. Go to the national meetings in person if you can, or just Zoom in if that's an option for you, and see what's going on. What are they talking about? What are those organizations working towards? You can go a step further by serving on a committee. And the way that I got involved in the advocacy committee was reaching out to Teresa, who was the chair at the time during the pandemic, and just bugging her like, hey, I've got a petition that I want to circulate to all the physicians and med students in Tennessee. Like, how do I do this? Can you help me? So if you want to serve on a committee, that's great. We're always looking for folks to join and get involved. If you don't want to do that, it's fine to just reach out to the committee members and ask them for help on an issue or project that you want to get accomplished. We're always looking for someone who wants to get more involved. You can organize event, like the students who organized this call today. Thank you all so much. This is amazing. There are so many different things you could think about organizing. When I was in residency, we had a bike safety fair every year where we distributed bike helmets to kids and taught them about safe riding their bicycles. And it was a lot of fun, and also taught kids about, being safe with their helmets. So you can start small and do something like that. I wanted to highlight a bunch of different organizations. This is just scratching the surface. There are so many other orgs that you can think about joining, but these are just a few here I wanted to highlight. Physicians for a National Health Program is a great organization that is focused on universal health care, getting everyone health insurance. Doctors for America advocates for a number of different issues. They're a great organization, love them. Physicians for Reproductive Health, for those of us who are interested and concerned about repro rights. That is a great organization that is working really hard to make sure that doctors are out there in the states where there are abortion bans and beyond, talking about the issues, educating the public. They're getting doctors trained up and media savvy, and so much so that they are testifying in front of Congress and committees. So highly recommend them. On Call for Kids is a kind of a new baby organization that grew out of the mass shooting that happened on July 4th in Chicago at a parade. And a bunch of pediatricians were like, let's do something. And so they started getting groups of doctors and other medical folks together to go to DC and lobby on the federal level for federal gun legislation. And so I was involved in their second lobbying day in DC. So that was October of last year. This is a picture of us in the halls of the US Senate. And we lobbied for safe storage, which was Ethan's law. We lobbied for a red flag law and universal background checks. And we went to, because this was our Tennessee delegation, we went and met solely with Republicans because that's who we're dealing with here in Tennessee. Some of the conversations went better than expected. Safe storage was the one bill that they were most willing to listen to us on. But that is an ever-growing coalition of concerned folks, mostly pediatricians, but any doctor can get involved with On Call for Kids. If any of you are interested in getting involved with that, I can get you hooked up with those folks. Their Future Our Vote is the political action committee formed by Dr. Annie Andrews, and they are trying to get folks that are focused on kid-friendly policies elected to office. So highly recommend following and looking up her org. If you're in Indiana, Good Trouble Indiana, you might have heard of them. Gabe Boslett is, I believe, a pulmonary critical care doctor who founded that, and they advocate for all things healthcare related at Indy. The Committee to Protect Healthcare is an organization founded by Dr. Rob out of Michigan. He ran for office and now has an organization that's helping advocate for a whole bunch of different issues in multiple different states. They're helping to promote physician voices. So doctors who are writing like opinion editorials and putting out press releases, speaking to media in states like Wisconsin, Arizona, Missouri, states that have abortion on the ballot, and helping to amplify their voices. Protect My Care is a group that does physician advocacy here in Tennessee, and it grew out of the push for Medicaid expansion in our state, which unfortunately has still been unsuccessful. We are one of the 10 states left that hasn't expanded Medicaid. So we still advocate for that, but since COVID, we do a lot of COVID safety advocacy, and then repro advocacy and gun safety as well. And then there's the Ohio Physicians for Reproductive Rights, who is a great organization that got involved, and I believe we're pretty big in the push to get the abortion measure passed in their state constitution. I believe last year, might have been the year before. So I want to segue briefly into talking about civic health. For those of you who don't know, August is Civic Health Month. And so I want you all to figure out who represents you. Who are your representatives? If you have moved recently, you might be in a new district. People get redistricted all the time. And so you may not know who your representatives are. this is a great website that you can go to and type in your address, and you'll be able to find out who your city council people are, your school board representative, your state representatives, and then your Congress people, your congressional reps, and your US senators. So that's great information to have in your back pocket when you want to know who you are going to be talking to if you're going to advocate at the state legislature or beyond. Make sure you're registered to vote yourselves. Vote.org, you can type in your address, double check that you are registered at your current address, and they'll have all the information for you there about voting dates. Talk to your patients about voting. So AMWA is a partner with Vote ER, and in this picture here, I'm wearing one of their ID badges that with a lanyard that you can wear in your clinic, in the hospital, wherever you are. There's a QR code that you can have patients and others scan that will take them to a website where they can check their voter registration and learn about why it's important to vote. Highly recommend that. It is free. If you go to voter.org, you can get one sent to you. When I talk to patients about voting, I just, especially since August is Civic Health Month, it gives you an excuse like, hey, this month I'm talking to folks about their civic health and the fact that healthier democracies, you tend to have healthier neighborhoods and communities. So it's important to vote. It's an election year. Would you like to scan this QR code and make sure you're registered? And I've had good response from the patients that I've used it on. It's a nonpartisan thing, so you can do it in your hospital. You may want to get permission from, your attending or your program director or whoever, just to make sure that you're okay doing it. But there are so many different residency programs, medical schools that are partnering with this. Shouldn't have a problem getting permission. I had none getting one from my hospital. You can order or organize a voter registration drive through VoteER. There are a lot of hospitals doing that. There was an article in JAMA recently that showed that when hospitals have voter registration drives and register voters, the younger folks and people of color turn out to vote in higher numbers, which is great. Don't forget to vote yourselves, okay? So vote.org, where you go to check your voter registration. You can also look up your voting dates. So if you have moved around for residency or medical school or post residency training or your career, every time you move, you need to re-register to vote or update that information. Some states make it harder than others. Some states have automatic voter registration. A lot of states don't. So don't forget to vote. Put those dates in your phone when the deadline is for your absentee ballot, if that's what you plan on voting, back home where you live, if you're training elsewhere. Early voting dates. It's important to put those in because you can vote at your convenience usually during early voting and get that just crossed off your list. So you don't have to worry about if you're on call or post night shift or something comes up on actual voting day. And another incentive to vote is when you do get involved in legislative advocacy, the legislators and like the Congress people folks, they can look up your voting records because that is public data. And if you are someone who votes and votes frequently, they kind of listen to you a little bit more, I feel like, because they know you're active participant in democracy. So just know a little bit of a tidbit that I learned doing this work. Here's a QR code y'all can scan real quick if you want to get you ready and knowledgeable about voting this election cycle. All right, so moving on to legislative advocacy. This is my passion. I got involved in this just a couple of years ago, so I'm still learning the ropes, so to speak. I am not an expert on this, but I want to talk to you about what I have learned along the way. Anyone can lobby. You do not have to be a lobbyist to lobby your lawmakers for or against a certain bill or idea item that's going around. Introduce yourself as a constituent. If this is your state lawmaker, the picture in the top right is my state representative. You may have heard of him, Justin Jones. He is a community activist who ran for office a couple years ago and got elected. And he was expelled from our state legislature last year in a very traumatic special session, and but we reinstituted him, and then he got re-elected, and he's running for re-election again. I think this is like his third time running in 3 years or something, but he's an amazing person. I'm so glad and lucky to have him as my representative. But once you figure out who your people are, which we went over that in the previous slide, introduce yourself. If you're not already familiar with them, they're not familiar with you. You can send them an email or call their office or pop by their office and just introduce yourself. Like, hey, I am Katrina and I'm an emergency physician. I live in your district and I'm concerned about the health and safety of our community. Would love to discuss with you further, meet with you in person. You could use me as a resource. I'm here for you. And so that's a great way to just introduce yourself as that person. Who can you lobby? You can lobby pretty much everyone we talked about earlier, your Congress, your state legislature. You might have a county commission, your city council members, the school board. You can contact them via email, phone, or visit their office in person. If this is like a federal representative, they probably have an office somewhere in your state. If you live in the capital, I'm sure they have one there. Some of these folks that have big districts have several offices, both in their home states and the DC office. So if you live in DC, you're set because you can contact these folks and go pop by whenever. If you live in your state capital, that's great. You're very lucky and blessed because you can go visit them whenever. And you don't have to set up a meeting ahead of time to meet with these folks. I do a lot of what we call pop-bys, where I'm just down there for a committee meeting or something else is going on down there at the state capitol, and I just walk by their office, see if they're in, talk to their legislative aide, and schmooze them a little bit, and ask if they're free for a minute or two. A lot of times you'll be able to just do a quick informal meeting, but if you want to schedule a more formal meeting, then you go through their legislative aide, who will help you schedule that. Couple of lobbying tips I wanted to go over. Be professional and courteous, okay? Best behavior, basically. Use your credentials. So if you have that MD, DO, MPH, PA, NP, whatever it is that's behind your name, use those credentials. Make sure they're aware that, hey, I'm a doctor, or I'm a doctor in training, or I'm a, whatever your initials are behind your name. Use that because it gives a little extra weight behind your name to what you're saying, especially if what you're talking to the legislator is something that directly impacts healthcare and the healthcare community. Facts are important. We're very data driven in medicine. We love our evidence and our research and our stats, but stories really help frame an issue for legislators, and they love stories. If you tell them a great patient story about how opiate harm reduction by doing needle exchanges statistically is shown to improve outcomes, that's great. But if you have a story about how a needle exchange program directly helped save someone's life, without be HIPAA compliant, so don't share names and obvious details, they love those stories because they can share them with other legislators. They can share them at committee meetings. They can use that to be like, okay, this is why we care about this issue. This is what the data shows, but this is a personal story. So if you have those stories, totally use them. Bring something to leave behind when you're meeting with folks in their office, whether it's like your business card, if you have one, a printout of an article that you're is related to the topic you're talking about, a study, like a JAMA study or something in New England Journal of Medicine, something that's related to why you're there talking to them. Leave that behind. You can write if you don't have a business card, I don't, because I don't have a clinic. I work in the ER, right? It doesn't make sense to have a business card. You can write your name and your number and your email on top of the leave behind. When you meet with legislators, you usually only have 5 to 10 minutes tops with these folks because they're very busy trying to get a lot of meetings in a day between their committee hearings and their caucus meetings, all that kind of stuff. So taking a leave behind can give them something they can reference afterwards, and kind of look at their leisure and reinforce whatever you were there to meet with them about. Send a follow-up email. Very important. You just want to thank them for their time, thank them for meeting with you. Maybe say how nice it was to meet with them, or like if you had like a specific story you talked about, you can reiterate that. That's also time where you can link to articles, news items, whatever reinforces the point you were making. And so that way they'll have something else to read. Some more tips: do not burn bridges. I've met with folks on both sides of very hot button topics, and sometimes those discussions can get a little heated. If you're finding it being difficult talking about an issue with someone, it's okay to be like, let's take a break. Let's agree to disagree. Let me come back and meet with you another time. That is perfectly okay to say. You can end a meeting whenever you want. I sat across from a state legislator last year when we were trying to get exceptions to our abortion ban passed for rape and incest. And this person looked me in the eye and said that 13-year-olds are physically able to handle carrying a pregnancy to term. And that was why she didn't feel like children should have exceptions to our abortion ban. And I think steam probably came out of my ears hearing that. But this was a legislator that is a reasonable person. She's also a healthcare person, and I did not want to yell at her in the heat of the moment and burn that bridge and not be able to work with her in the future. So, it's just like, well, while that might be true, I think we can agree that most 13-year-olds are not mentally able to handle that kind of change to their body and becoming a parent. So at that point, it was like, let's agree to disagree and, have a great rest of your day. So don't burn bridges, because you probably want to work with these folks on other issues if this is something that you're passionate about. Who are you speaking for when you're in these meetings? Are you there as a private constituent, just a member of the community? Is it just you're talking for because it's an issue that just affects you? Or is this something that you are, speaking for the medical community as a whole? Are you there representing an organization? So when AMWA goes to the Hill, we're representing not just ourselves, but the entire organization. So you have to be careful when you're speaking, if you're speaking from the organization, that you're only advocating things that the organization has agreed to. If you need to segue, you can say, well, this is what AMWA is saying, but personally, I also want you to look at this or whatever. But just make sure that you're kind of dividing that in the conversation if you have to. I've gone to meet with legislators with the Tennessee Medical Association on their Doctor's Day on the Hill, where we're all going around together in our white coats meeting with folks. It's pretty obvious, like, we're speaking for the entire TMA and thousands of doctors across Tennessee, versus when I'm just there by myself, like this photo here. I was also representing TMA that day with my white coat on in a professional capacity as doctor of the day, but it's just me meeting with them one-on-one versus a whole team of doctors. So just make sure you're careful to know who you're speaking for, who you're representing, and what you're trying to accomplish. Don't be afraid to take a buddy. When I first started meeting with legislators, it was very intimidating going into these offices and meeting with them. You think like, oh gosh, you got elected to office, like you have so much power. They're just people, right? They put their pants on the same way we do, one leg at a time. They drink their coffee in the morning just like we do. They have the same kind of concerns, and they have day jobs too. This gentleman here, Representative John Ray Clemens, is a lawyer in his day job. Most state representatives, it's not a full-time job, so they have other things they're doing and other things they care about. So just, take them off that pedestal that we tend to put them on. But just, if you're intimidated, take someone with you, and that's okay. They don't even have to speak. You can just be like, hi, I'm so-and-so, I'm here to talk to you about whatever, and this is just my, colleague or friend or whoever who's coming with me. They don't even have to speak. Just having a friend or partner, someone there with you sitting next to you in that meeting can just give you an extra boost of confidence and know that someone's in your corner. But it's not totally necessary. I've met with legislators on my own. I think maybe for your first time or first couple of times, you might want to take a friend or colleague with you. But if you're one of those super confident people, you can go by yourself. It's fine. So leveling up. After you have mastered the art of meeting with legislators in their office, there is more you can do. You can testify in committee hearings, and anybody can do this. You do not have to be an expert on whatever topic. You just have to know how to sign up to do it. Find out the rules. Every committee has different rules. Some committees you can just go and sign up the same day. Some committees you have to sign up 24 hours. Some it's like a week in advance. Some you have to like sign up through the committee chair, or a member of the committee has to put you on the speaker roster. So find out those rules and make sure you're sticking to them. Practice what you're going to say. So I would say write it out and rehearse it several times. If you're going to testify in these hearings, you usually only get like 2 to 3 minutes tops to get your point across before they'll cut your mic and say you're out of time. And then there may be a question and answer period where different members of the committee will ask you questions. Now, full disclosure, I have not actually testified in a hearing before. This picture is me speaking during a public comment period during the Government Operations Committee here, where they were talking about sunsetting our entire medical board because they were upset that our medical board officials were sticking by their policy to punish doctors who spread misinformation and disinformation. And so I went to speak in the public comment period in support of that rule and not abolishing our medical board, which sounded ridiculous at the time. How to dress for these things. So I was just going to public comment period. It was not like a formal testimony. So I just made a statement with the shirt I was wearing because we had some anti-vaccine rhetoric spreading around our state legislature, and made sure to wear my mask to emphasize COVID safety. And yes, you can still hear me speak through a microphone with a mask on. So, I was just kind of doing that. These meetings tend to be recorded and they're televised, sometimes just on the state legislature website, but sometimes there's like a closed caption, like TV in your, if it's like city council or something that might be on like the local stations. So know that you might be on camera, probably are going to be on camera. So dress appropriately. Like I said here, I'm making a statement, but doctors who've testified in committees, especially on really important issues like the abortion ban, gender affirming care ban, gun safety legislature, tend to dress very professionally in clothes that you would wear to a job interview or seeing patients in clinic. I've seen people testify in scrubs and wearing white coats as well. So anything that just portrays confidence and professionalism is the way to go when it's a formal testimony. You can help legislators work on bills. Like there are physicians, med students, residents, there are folks who've worked with legislators like, hey, this is an issue that I'm seeing, like this is something that's bad for the community. Let's work on this together. I can help you with language, or, you just bring the issue to the legislator and let them take the reins from there. Another way to level up would be to run for office yourself. Here are 2 examples here in Tennessee. So the woman in the top right is Dr. Laura Andresen, who is an OB-GYN, and she is running for office in our state legislature. She's a very loud, proud reproductive rights advocate who has gone above and beyond so many times. She has testified in committees. She's been there at our press conferences. She's written op-eds, spoken to the news, educated the public as much as she can about how the abortion ban that is so strict here in Tennessee is really affecting the care of patients. And she felt like, I'm not getting anywhere, so she's running for office. The bottom left picture is Dr. Jason Martin, pulmonary critical care physician who presided over an ICU that lost 400 patients during COVID in suburban Nashville, and saw, our our state being one of the worst in its handling of the pandemic, and decided, you know, it's time to run myself. And so he ran for governor. Unfortunately, didn't win, but I was so proud of him for stepping up and doing that. I met him during advocacy work before he ran for office. And so I was lucky enough to be there the day he announced his run, which is what is pictured here. Another doctor who ran for office, Dr. Annie Andrews. She ran for Congress in South Carolina 2 years ago. Unfortunately, not successfully, but sometimes even in failure can come triumph, because now she is using the voice and platform that she gained from that run to advocate for all things healthcare all across the US by trying to get more doctors involved in advocacy and politics. Another doctor who was involved in politics, you might have heard of Dr. Virchow's triad. He has this famous quote, medicine is a social science and politics is nothing else but medicine on a large scale. So this is a picture of a group of physicians and I at a political fundraiser for a candidate running for office here in Nashville. Another great way to advocate is through your social media. But if you're going to advocate for anything on social media, make sure you're HIPAA compliant. Don't get in trouble. You don't want to put any kind of patient identifiers, patient information, no pictures of x-rays or wounds or whatever, unless you have specific permission from a patient to share. But I just wouldn't even go there. Keep it vague, keep it non-identifiable. This is a tweet that I sent out about, how important it is to just wear a gosh darn mask, and how hard is that? Be civil if you can, especially if you have those credentials behind your name. We don't want to be calling names. We don't want to be a nasty, person, especially if you're trying to educate the public. We just want to be professional, like we would be if we're talking to a patient in the clinic. It's okay to ignore the comments. I had to learn this myself the hard way. If you post even something as simple as like, wash your hands and wear a mask, people will claim that you're getting money from Pfizer for vaccines and call you horrible names. Just ignore them. You're not an elected official yourself. You do not have to engage. You don't have to look at it. You can delete and block till your, heart's content. Use the opportunity, if you're going to be an advocate, to educate the public on whatever topic is important to you. We've seen folks do really great work on social media, educating the public on, the importance of social distancing, getting vaccinated, reproductive rights, gender affirming care, you name it. There's someone out there in the medical field that's advocating for it and educating folks on the science behind while we're saying these things in social media. Also, remember, whatever you say online, that's public record. It's not Vegas. Everything you say is out there, and it's out there forever. Couple of accounts to follow. Some of y'all might recognize this picture. This is Dr. Glockenflecken, and he is a wonderful social media advocate who makes these really hilarious parody videos making fun of every field of medicine. I don't think anyone has avoided getting lampooned by him, including emergency physicians who he portrays as doctors that always wear a bicycle helmet and drink nothing but Diet Coke. And it's funny because so much of it is so true. But Annie Andrews advocates for pediatric issues. Dr. Jennifer Lincoln is an OB-GYN who advocates for reproductive rights, and she's with Mayday Health that does all kinds of efforts to get the word out about Plan C. Dr. Mark Shapiro won our Larry Zaroff Good Man of Conscience Award last year. He's a great gun safety advocate online. Dr. Joseph Sakrin as well. Tyler Black and Jesse Gold are great mental health care advocates. We were lucky enough to steal Jesse into the state of Tennessee, and she is working in Memphis now. So that's awesome. And then Jack Turbin is a wonderful gender health expert who posts about gender affirming care. Ryan Marino is a toxicologist and EM doctor who posts about harm reduction with regard to opiates, but also other toxicology related things. If there's some weird, stuff going around, like all the fentanyl being put in street drugs, he's going to be one out there commenting on it and educating the folks about it. Another place you can advocate is in the news media, so traditional media. You can do interviews with the press. You may need to go through some prep work to do this. Sometimes it can be a little touchy, especially during your training, and even for some folks that are outside of training to speak to the press. There are certain hospitals where doctors have been, explicitly told you cannot talk to the media about a certain issue. But we're also private citizens. We can speak for ourselves. You do not have to put like doctor, at some hospital underneath your name like I have. You can just speak as a private citizen if you're concerned. You can also speak to the press anonymously, which I have done a few times as well, especially on an issue where I was worried about any kind of backlash. You can write a letter to the editor if there is an article in the newspaper or whatever that you're like, gosh, they really got this wrong, or that's something I would like to comment on. A letter to the editor is a great way to advocate, and it can be pretty short. I've seen letters to the editor that are just like a paragraph long. I've seen a couple paragraphs, and you can send those in whenever. Opinion editorials take a little more time, usually like 500-600 words. You may need to finesse that and have someone kind of proofread. AMWA has all sorts of different folks who are good at that, and we're happy to help any of y'all who want to write an op-ed about anything, and just get that published. Local news shows. This screenshot here is a picture of myself on a show called Open Line, which is on our local news station. It comes on after the nightly news, and it's a program where they have folks come on and talk about a hot topic, and people can call in and ask questions, which was very intimidating the first time I went on, because we were talking about abortion, and I live in a red state. So we didn't know what was going to happen, but the majority of the folks that called in were actually very supportive of repro rights and had very thoughtful questions that we went through and answered. Podcasts are another great place you can advocate. Just listening to them can be a great source of information. These are a bunch of different ones I recommend. Explore the Space is Dr. Mark Shapiro's podcast. And one of the reasons why I nominated him for the Larry Zaroff Award is because he has highlighted so many wonderful women physicians on his show. He invited me to talk on his show. I think it was last year, and we had a great time, had a great discussion. Another physician he has on there frequently is Dr. Kimberly Manning. She's an amazing storyteller in medicine. Highly recommend following her. The Glockenfleckens pod is great. Their Future pod is awesome. The OG Advocates was really active after the Dobbs leak and leading up to Roe being overturned, and then the immediate after effects. They haven't really had a whole lot since then, but if you want to go back and listen to those episodes, it was great. And the Nocturnists, amazing podcast. Two different series I wanted to mention from them. One was about shame in medicine, which was very powerful done series. And then the second one was about practicing medicine in the post-Roe period. Both were great. Now, you could start a podcast yourself, or you could just reach out to an existing podcast with an idea for a story, someone that you feel like would be a good guest, or if you yourself want to go speak, just contact the person who's running these things. They're always looking for new content and someone to talk to. You could write a book. Yeah, if you have a whole lot of words inside you that you need to get out. So many different books written by physicians that advocate for any number of things. I'm currently reading the one on the top left, Free to Be, by Dr. Jack Turbin, and it's very eye-opening, all about the evidence and the science behind gender identity and how to understand it. And it's been very eye-opening, very well written. I love it. So how I got started in advocacy, I was not an advocate from the get-go. I did not do advocacy work in medical school. I wasn't an advocate in residency. Even like my first 5 years after training, all I did was work and play. I did not really do anything extra. So in 2016, though, a lot of things changed, and you probably know, why I got there. But the picture on the left was my very first women's march. And this tells you how prepared I was for it. I didn't know what to expect going to a protest rally march. That was my friend made that sign for me, and I liked it so much. And it's so me. I have two cats. But the second picture was the second march where I was definitely a lot more ready. Had my pink hat and my shirt and my sign and my best friend. So that was kind of me dipping the toes in the water, so to speak. But really, I didn't get totally involved in advocacy until a couple years later when I found myself being really burned out at my job and wondering, what the heck am I doing this for? And seeing a lot of victims of gun violence in my ER, very tragic cases where we lost several young adults, and telling their families that their loved one was dead was very, very hard. Something we learn how to do in medicine, right, is the death tell, but it's so much harder when someone's ripped away from gun violence because it's so unexpected, and a lot of them are very young, and it's just really hard. So I went on a mission after several losses to figure out how to prevent gun violence and injuries in the first place. I was like, there must be somewhere upstream we can go to help prevent this so that I don't see these people coming in filled with bullets. So a little bit selfish on my part, whatever gets you into advocacy, everyone has their reason. But I did some research and I found Cure Violence, which is an organization in Chicago that does gun violence prevention advocacy work, and they come through it from an infectious disease lens. They were founded by an ID doc, Gary Slutkin, who did a lot of research when he came back from Africa about the gun violence that he was seeing in Chicago, and was like, it really spreads like an infectious disease. One little cluster leads to a bunch of other clusters around it. And he's like, if we could just prevent that one cluster, then all those other clusters of gun violence wouldn't happen. So I was like, that's an idea I can get behind. I would love a cure violence program in my city. So I reached out to them and found out about this wonderful group called Gideon's Army that was already doing that work here in Nashville. So I reached out to Rashida, who is the founder of the program, and we got together and brainstormed, how do we bring your violence interruption program into the hospital? And we went on a mission, and we got as far up the ladder as the CEO of our hospital, who agreed this was a great idea, but my hospital wasn't willing to fund it. So once I get a bug in me, I'm not going to give up. I decided, okay, well, if you're not going to fund it, I will do what I can to do it myself. So I hosted a fundraiser in my home. This is a picture of that night. We had a very good attendance, raised about $4,000 that night. And my first dipping the toes into state legislative advocacy was inviting my state senator, who's in the suit on the left here, and he showed up. I had no idea he was actually going to show up, but I sent him the details and the invite and said, hey, this is a group doing good work. I'm having a fundraiser for them. Please come. And that was amazing. I was actually starstruck, which now he's just a regular Joe. But the first time you meet a legislator, you might be like, oh my gosh. From there, like once the ball started rolling advocacy wise, it just kept going. The pandemic happened. I needed to speak up because I was seeing patients dying in my ER, and I just knew we could be doing better here in Tennessee. That's how I got involved in AMWA a bit more, reaching out to Teresa, trying to round up anyone in Tennessee that wanted to help me. And that's how I found Protect My Care. I signed a petition to the governor for a statewide mask mandate, and the originator of the petition reached out and called me and said, hey, would you like to get more involved? And I was like, well, yes, I would. So that led to me speaking in my first press conference via Zoom, calling out our governor, telling him he needs to come to my ER. And, the rest is history. So, now I'm involved with this Protect My Care physician advocacy group that we've done press conferences together. We've rounded up doctors to show up at committee hearings, speak in the committees, met with legislators, lobbied them. We did what we could, and I'm so proud of all we accomplished. I wish we had accomplished more, but we had a lot of legislators that weren't willing to listen. But through all that, I learned my voice and how to use it, started writing opinion editorials, helped my state legislator, Justin Jones, round up folks for a gun violence vigil after the Uvalde shooting, and reached out to students and residents at Vanderbilt. And so started getting other white coats involved in the movement and showing up to things. And then Roe fell. So, we had a trigger ban. We formed a loose group of doctors that we called ourselves Doctors for Repro. We have a group chat. That group keeps getting bigger and bigger. It started off as like just a handful of us. Now I believe we have, I think 70 or 80 doctors in this group chat all across Tennessee. We're sharing information. We're sharing stories. We're sharing, articles that we've written and that others have written. We started a petition. We got thousands of doctors to sign it, and we turned it into a full-page ad in our state newspaper. Took it out on a Sunday, so it had the most circulation, and then we ended up putting it online as well. We have hosted now 3 different Healthcare in Handcuffs press conferences where we show up at the state steps of the federal courthouse where if any of us gets prosecuted under our abortion ban, that's where we would go on trial. And we lobbied really hard for an exceptions bill. It wasn't everything we wanted, but we did get exceptions for ectopic pregnancies, for molar pregnancies, and for the life and health of the pregnant person. It's still not perfect, and there are still hesitancies from doctors to perform abortions, even for life or health. But it was a step in the right direction, and that was something that we accomplished together. And 2 of the doctors who are part of our group are suing the state to try to get the abortion ban overturned. So this is a picture of one of our Healthcare in Handcuffs conferences, and then the website where we have our letter still up online. And then because the ball just keeps rolling and things keep happening, we had a mass shooting here last year in Nashville at a private Christian school. 6 people were killed, 3 adults and 3 9-year-old children. And that was just devastating. I didn't know anyone directly who was involved. My nieces and nephews go to public school, not private school. But I was on shift that day, actually on my way to the hospital when my colleague called me and said, "Hey, there's a mass shooting, or there's a mass casualty event alert. We've been put on high alert with the EMS. Don't know what's going to happen." So, I knew something bad was happening when I was on my way to work that day. And, it was just really hard. We're not a trauma center at my hospital, so we didn't see any patients, but the pediatric hospital down the street, when they did receive, there was nothing they could do. All of the children were dead on arrival, and it was just heartbreaking. So that got me really upset, really angry, really wanting to do something. And so I learned that they were going to have a big protest a couple days after this, and a walkout with all of the students in high schools that were close by to the state capitol. So I found the organizers of the protest and said, "Hey, I'm an ER doctor. I've been involved in gun safety advocacy for a couple of years now. I would really like to speak at this rally." And I wrote my speech out, sent it to them. They were like, "Oh yeah, this is powerful. We'd like you to speak. That's great." I then, through my Protect My Care advocacy organization, reached out and said, "Hey, this is happening. If all of y'all could show up in your white coats with signs and stand behind me, that would be great." Because I spoke to a crowd of, it was in the thousands, and it was very emotional. We were all upset. We were all grieving. It's a tragedy that didn't have to happen. If we had had a red flag law, it could have been prevented. And so I stood on those steps that day, and all of these white coats were behind me, giving me strength to get through what was a very hard day. After that, we started lobbying hard with other advocacy groups to get some gun safety legislation passed. And so this is a picture of myself with a group called Awake, meeting with a Republican lawmaker, a moderate lawmaker, who was very interested in helping us pass the red flag law. And unfortunately, that didn't happen. And he decided to retire from the state legislature, unfortunately. So that's kind of my story. I wanted to end things with a couple of last tips for all of y'all. advocates, wherever you are in your advocacy journey, if you're like me and you've done a lot, if you're just getting involved, I want you to make sure that you take care of yourselves too. It's really hard to be an advocate because it can take a long time to see the needle move on a certain issue, to see change happen, to see those seeds that you're planting actually grow and turn into, those tall redwood trees, right? So you need to take care of yourselves as you're doing this. Pick the one or two, for me, I think it's 5 now, issues that you care most about and just focus on those. For me, I was like, okay, the way I'm limiting myself is it has to relate to healthcare. So, I don't have children. I'm not going to go down the whole book ban, school, public school kind of route. I want to focus on Medicaid expansion, gun safety, and repro rights. Those are my 3 main issues. But if you throw anything else healthcare in there, I'm probably going to be speaking out on it too. But that's how I'm kind of honing myself and keeping myself centered and making sure I'm not trying to do too much. Find your people, like finding my Doctors for Repro group, finding Protect My Care, finding other gun safety advocates has been so helpful. And just knowing that there are other folks that are in this with you, you're not fighting alone. The commiseration, the collaboration, the solidarity, it's awesome. Find those people, latch onto them, get in a group chat. It's a lot of fun and helps keep you engaged, motivated, recharged. But you can step back if you have to. If you find yourself getting too involved, too emotionally invested, just tired, fatigued, it's okay to stop. Like no one's paying you to do advocacy, right? I don't make a single cent on any of the stuff that I'm doing outside the hospital. So you don't have to do it, right? Someone else can pick up the torch if you have to put it down. And just know that you can say no. It's hard. We want to say yes to everything because we want to change the world. We want to make it healthier. We want to make it safer. We want our patients to have good quality lives, right? And ourselves. But sometimes the best thing for you is to say no, especially, I've been asked to do interviews on specific medical procedures that I'm like, I don't know anything about that. I'm an ER doctor. Let me get you to the person who does know and connect the dots there. That's okay too. If you know someone who can help that issue, connect those folks, make those things happen. Your voice matters. It really does, y'all. We are trusted figures in the community. Even though that trust has eroded a bit because of what happened during the pandemic, we still, I think we're below nurses, but we're still up there in the most trusted professions in the US. So people trust what you have to say. You're an expert or becoming an expert on whatever field you're going into or are already in, right? So you know what you're talking about. We are leaders. We're natural, maybe not natural, but we are made leaders, right? We lead our medical teams in the hospitals. We lead our clinics. We lead our, our groups, our organizations. And so it's okay to be the leader of a movement as well. You've got that experience. You know exactly how bad health policies and bad bills and bad laws affect your patients, right? I know firsthand how bad things are here in Tennessee because hundreds of thousands of people don't have health insurance. We didn't expand Medicaid. Like those people have nowhere to go other than my ER, which is not the best place to be getting primary care. I don't do preventative care. I can't do a screening mammogram or a PSA or all of that stuff. There's no one to follow up on it. So getting folks the care they need is so important, and telling those stories because you have that experience is so powerful. It may take you some time to find your voice, but you have a voice and you can find it, whether it's just showing up at a protest or a committee room with a sign that says something powerful, with a shirt on, with your scrubs on, with your white coat on. That's powerful too. And that is a way to use your voice, not even vocally, right? You can use it using the written word. You can write emails to legislators. You can sign petitions. You can just stand there in solidarity with others who are being vocal and give them that confidence to say what they need to say. So find your voice and use it. And know that there is strength in numbers. You do not have to do this work alone. You will not be doing this work alone. There are others who are doing it, who want to do it, who want to get more involved. When I sent out the call to come protest the governor's State of the State address. I didn't know if anyone else was going to show up. I was planning on going there by myself, holding up my sign. This is the state of healthcare in Tennessee is not good. And had the data to back that up if any reporter wanted to come talk to me. But I sent out a call saying, like, would anyone want to join me so I'm not standing alone? And all of these folks showed up. The next year we did the same thing, and it was like triple the numbers of folks showing up. So if you do the work, people will notice and they will join you. With that, any questions? I see there's a lot of things in the chat. I have not been looking at that. So yeah, that's about it.
Thank you so much, Dr. Green. That was like such an enlightening and I think inspiring discussion for everybody. I think we all learned a lot from you for sure about, how to be advocates. And I just want to like also, take a moment. And we have some other AMWA group chairs also on the meeting call, and I just want to give them maybe opportunity where they can, share like what advocacy plan they have and what their like consideration for the group if anyone was interested in hearing. I can start with the AMWA Gun Violence Solutions. I'm currently the medical chair along with our co-medical chair, Miss Sarah, who's a medical student up in Michigan, and we're focused, on advocating for some like gun safety laws because, gun violence and firearm violence is the number one killer of like pediatrics and women who are pregnant. And we have a bunch of different projects going on, such as, writing statements for AMWA that we hope can be submitted, as well as like working on our podcast and loading gun violence solutions to committee. I know we have also like the AMWA domestic violence group here too as well. So you can reach out to Miss Courtney Chow, who's also on this call too. But thank you so much for coming, everybody. You all are amazing, and the future is bright for advocacy, I think.
Awesome. Thank you guys so much for having me. I just dropped my email in the chat if anyone wants to reach out. Happy to help with anything advocacy related or whatever else.